So I'd like to introduce Dr. Ariane Carpentier. She's going to be speaking about hospitalization, one of our wonderful fellows.
Okay, good morning. I'm super happy to be here and to talk about that very important subject that is very close to my heart. So I think people are still settling in, so we'll go slower. And I'll start just with a very doctor thing. I have nothing to disclose for this talk. It's just something that I'm really passionate about. And so we'll start with a few facts about why hospitalization in Parkinson's disease is so important. So you might have been hospitalized in the past, or you might have seen one of the persons that you're taking care of being hospitalized. And there are so many reasons to be hospitalized with Parkinson's disease, right? It could be for a simple surgical procedure that has nothing to do with your Parkinson's, but it could also be related to complications of your Parkinson's or complications of your Parkinson's disease. And so the facts that are that 4 patients out of 12 with Parkinson's disease will get hospitalized each year. Like I said, it could be for a regular surgical minor procedure, but some of them might have longer hospitalization, and that's why it's super critical to talk about this. People with Parkinson's also have a 50% higher rate of admission than other people without Parkinson's. So they're at higher risk of being hospitalized. And not only are they at higher risk of being hospitalized, but also they have higher complication rates, longer hospital stays, and higher mortality. And we know this is related in part to the Parkinson's. And unfortunately, there's not a lot of things we can do about it. Some of it is related to the comorbidities that people have related to with their Parkinson's. And then what we can really work on, and a lot of the things I'm going to tell you about today is about this last part, is what we can do to help our hospital and our health system with reducing the rate of complications, longer hospital stays, and mortality in people with Parkinson's. So, Parkinson's. Okay, it's there. And we know that people with Parkinson's have, whenever they have an infection, and you might have had that in the past, they can have worsening of their motor symptoms or then their non-motor symptoms. And that's a frequent question we get. People send us messages, and they're like, you know, my wife is getting slower in the last 2 days and she's freezing a lot. And the first thing we tell them all the time is make sure she doesn't have an infection. Make sure she doesn't have a UTI that is kind of happening right now and is causing the Parkinson's to worsen. So that's something that happens very frequently. And so you can imagine when you're hospitalized for pneumonia or for an infection, this is also the case. The Parkinson may worsen. And also, a stress, just like a surgery or being hospitalized, can worsen your Parkinson's symptom. So there's not a lot of things we can do about it. Just know it's happening and be mindful about it. The other thing that can happen, and can happen with people without Parkinson's, can happen with older people with a lot of different diseases, it can happen with dementia, is delirium. And so people with Parkinson's disease can experience what we call delirium. You might have never heard that word. Some people hear it in the context of alcohol, but delirium is actually an entity, is when people get confused in the hospital. And you might have seen that in your parents, in your friends, when they get hospitalized and then they start saying weird things, or they have aggressive behaviors, or they get very sleepy, or they are sleeping throughout the day but not sleeping at night. And that can happen at home too, but that is what we call delirium. And so that can happen a little bit more frequently with Parkinson's, and it's something to keep in mind, and that we cannot do a lot of things about it. If you're a caregiver, the main thing is making sure to always orient the patient that is confused, and we want to make sure the other factors are under control, treating the infections, etc. The other thing with Parkinson's disease that we can control is the other diseases that you have. And so as we get older, we are not immune, because we have Parkinson's disease, to have any other conditions. And having all of those comorbidities can influence the care you get and where you get it. And that's an important issue because ideally, you would always be admitted on the neurology floor with a movement disorder specialist, with nurses that are trained in Parkinson's, with people that know that medication on time is super important, but that's not the reality. Sometimes you're going to break a hip and be hospitalized on an orthopedic floor, and it can be a very different reality. And so having comorbidities will definitely change where you get your care and how you get it. The other important aspect is having comorbidities makes also people with Parkinson's at higher risk of getting hospitalized. And it could be COPD, it could be anything else, but we know that people that have both Parkinson's and other diseases can have more hospitalization, higher risk related to it. And that's the third one that I'm not super proud or happy about is whatever the hospital system is doing to people with Parkinson's when they get hospitalized. And today is about what we can do as medical providers, but also tips for you that you can do when you are hospitalized or that your caregivers or you as a caregiver can do when one of your significant other family member is hospitalized. Issues with hospitalization happen at all the stages of a hospital journey. It happens even before admission. It happens when you're in DED. Like one of the scenarios that happens is people don't get their medication when they're waiting in DED, right? So, for example, they didn't bring their carbidopa, levodopa with them. They're waiting to see a doctor. It takes more time than it should. And so not taking medication on time is the first thing that can happen when you're waiting in DED. But you're also having interaction in an emergency room with people that might not be used to Parkinson's disease. And then people get admitted. And what can happen at that point is the prescription of your medication might differ from what you're taking at home. Sometimes just recognizing that you have Parkinson's disease might be an issue. It sounds very simple, but it can be an issue. And then you're hospitalized, and so many things can happen at this point. The fact that you're not receiving medication on time, the fact that you're not moving as much as when you have your dancing classes every week, the fact that you can have an infection and get a delirium, and all of these things during hospitalization, if we're not doing everything to minimize these complications, can lead to longer length of stay, but also to more readmission, maybe not being able to go back home after a hospitalization. And at discharge, it's super important, too, to have a plan of, okay, I've had this huge hospitalization, I need to see my doctor, I need to go home and have a plan of making sure I'm still taking my medication the same way I was doing before that time in the hospital. So my tip number one for you is always be prepared. You never know when you're going to need to go to the hospital. That's sad, and no one knows. But it's even more important when you have Parkinson's disease or you're taking care of someone with Parkinson's disease. And so if you don't already have that, that's going to be your goal for tomorrow. You're going to prepare a bag that has all the essential items if you are hospitalized. And so you want things that you're going to need, a list of all your updated medication with the time you're taking it. You can have a doctor's letter saying, have Parkinson's disease, just in case you're not hospitalized in, at UF or wherever you're getting your care. It's super important that you have something that says, I have Parkinson's disease, in case you're not able to say that. You want a list of your emergency contacts, and ideally some of your medication supply, so we're always ready to take some medication, whatever is happening. Then ideally you also have a copy of your advance directives, because we never know also when you're going to need those. And you want people to know, and you want to remember where that care bag is, right? Otherwise it's not going to be useful. If you're getting your care at the Fixel or at any other centers, we have these Aware in Care kits that are kind of already have these information in it, and you can just fill in the blanks. And there's already on the Parkinson's Foundation website all of this information that you can also print at home. So you go there, parkinson.org, hospital safety, and you can print all the information, fill it in, and it's done. Tomorrow, your goal is already done. And so we'll move forward to all the different problems that you can have while you're in the hospital. So starting with identification of Parkinson's disease. And I told you, this really should make sense. Like, yes, people should know you have Parkinson's disease. But you would be surprised how often, like, it's not necessarily clearly indicated in your chart. And that's because our electronic medical records are great, but they're kind of complex. And so depending on where we put the diagnosis, it might not show up systematically. And so that the people seeing you in the emergency room, they might not know that you have Parkinson's. Hopefully by the admission, they know, but at that point, it might be tricky. And knowing that you have Parkinson's is really important because it can help us trigger alerts. Now that we have technology, if someone comes in, steps in the hospital, and has Parkinson's, and we have a system to tell us and put an alert like, be careful, this patient has Parkinson, this and this and this can worsen the Parkinson, that can be very useful. And so that leads me to tip number 2, which is speak up. Tell people you have Parkinson. So you start getting care. It's either for a small surgery, for any procedure, or you're just going to the emergency room because you think you have an UTI. Just say, like, I have Parkinson's. This is important to know when you are getting triage. Then you will have your go-to bag now, as of tomorrow. And so I want you also to, the first reflex you should have is get your list out of medication that is updated with the timing at what time you're taking it, and give it to the people that are taking care of you. Then, it's rare that we all have like a lot of time when we're in the emergency room, but I think it's really important to discuss the importance of getting your medication on time with the providers. And so if you're waiting in the emergency room, just tell them, like, I'm going to take my Parkinson's medication. It's important. I need to take it on time. Otherwise, I might not do as well. And don't hesitate to ask questions or voice your concerns. And then sometimes you might not be able to speak up. Maybe you're going to be confused or something happened and you lost consciousness. So that's tip number 3, is you have to find an advocate for you. And I'm seeing people all around today with great advocates for them that are sitting next to them. And so that's amazing. And you want someone that is able to know what you would do if you were able to speak up. And you want someone that is also going to be able, once you're hospitalized, to be your advocate and continue to defend all of those points we're going to talk about today. So you want a dedicated care partner, someone who understands PD, so the persons that are with you in this room today are the perfect people for that, and that will know also what your medication routine is. Ideally, you authorize them to have like all the information for your care. So that should happen at admission. If it's for outpatient clinic, you can also always do that so we can communicate with that specific advocate care partner. And also discuss your advance directives with them. So it's always a hard talk, but it's important. It's a crucial talk to have before being in the hospital. And so once you're identified, and usually that's an easier part, but it's still a very crucial one, the main issue, the one issue that people really have when they're in the hospital is getting the right medication with the right dose on time. And there's so many reasons for that. So some of it might be they didn't put the medication at the right time. So you're taking your medication at 8, 12, 4, 8, but then in the hospital they put 4 times a day, and then you're receiving at 7, 12, 7, 3 in the morning. And then that doesn't make sense, right, for you. So receiving medication on time might be an issue. Receiving the right dose, we'll talk about it. Sometimes you're going to have a surgery and they will tell you you can't drink or eat anything for 12 hours. And then, so skipping some dose is a big issue. And then the last one is receiving medication that can make you worse. So there are some contraindicated medications that can be given in the hospital, and we're working on education and making sure people know that with Parkinson's disease you can't give those medications, but unfortunately it's still happening. So this graph is one that we did for more of an editorial, and it was about one of the studies that was done in the last year, which showed that it's an academic center, and they look at more than 500 admissions, 300 PD patients, and they look at the number of days where patients didn't receive their medication on time. And they qualified not on time being more than 30 minutes from their at-home schedule. And they found that 47% of days, patients didn't receive their medication in that 30-minute window. 19% of days, people didn't receive the right dose of medication. And that could happen for many reasons, but still a big issue. So 1 in 5 people. And then 10% of people, and that's, I'm telling you, a hospital center, so it's not a community hospital. 10% of people receive some contraindicated medication for their Parkinson. And so overall, this is one study. All the studies show that approximately 3 out of 4 people will not receive their medication on time, and 2 out of 3 people that don't receive their medication on time can have complications because of that. These are 2 studies I just wanted to show you because they look at kind of different outcomes. And so one from 2013, and what it showed is when after being hospitalized, and they didn't talk necessarily about the duration, so just being hospitalized for a number of days, 28% of patients had a worse motor outcome than when they came in. So this is looking at those tapping, opening your arms, rigidity, all the stuff we do in clinic. So they did that at the beginning of the hospitalization, at the end. And so some people got worse, at least almost a third. And medication errors, which including timing of medication, not receiving the right medication, occurred in almost 30% of patients. And this was the #1 predictor of why people had worse motor outcomes. And interestingly, in that study, the people that were able to take their medication in their room while they were hospitalized, none of them worsened. So that was a pretty good solution. The other study is from 2007, and it showed that 74% of patients had medication that was stopped, omitted, or prescribed inappropriately during the hospitalization. And then 61% of those had medical complications, which included infections, fall, longer hospitalization, higher mortality, and some morbidity. And so one of the main issues of receiving the right dose is some formulations might not be available at the hospital where you are hospitalized. So some of you might take some Rytary, some of you might take some regular yellow pills, Cinemet, some of you might take the blue version, some take the long-acting one, some take other medication, and we always have new medications, which is great, but it's really hard for the hospital to keep up with always having those medications available. And so all those different formulations make it hard for providers to convert to whatever medication they have in the hospital. And so some hospitals will be very nice and they will allow you to bring your own medication. You can always ask for that. So if you're hospitalized, they don't have Rytary, you can always ask, can I bring some of my Rytary, and it could be given to me by the hospital, and some hospital will agree to it. So that's a good tip to know. But it's also like sometimes you're not able to do that. You might be out of Rytary, and it's really hard to convert these medications. They don't convert one-to-one. And if you were switched from one medication to another in the past, you might already know that. So that's why sometimes the dose that you end up receiving is not exactly the dose that you were supposed to or the equivalent of the dose you were receiving at home. Then we already briefly touch about that, but when you're admitted, if people don't specifically enter the right dose at the right time, you might not end up receiving the medication the same way that you're taking it at home. And so this is another study with, it was 98 people with Parkinson's that also had an infection and admission, and 56% of those people, their equivalent dose of dopamine that they were receiving, because people were doing that conversion that I just told you about, that is not one-to-one, so 56% had a reduced equivalent dose, okay? So when they were in the hospital, they were receiving less medication, less dopamine than when they're at home. And so that also has an impact of increasing, having a worse discharge destination, meaning you might not be able to go home, and slightly higher mortality. So we really want to minimize these complications in general in people that are hospitalized with Parkinson's. And the last one, which is a very tricky one, is what if you have trouble swallowing when you're in the hospital? And swallowing difficulties happen for many reasons. It could be because you're more sleepy. It could be because you got worse because you have an infection. And then sometimes it's also the surgeon doesn't want you to take medication for 12 hours like we talked about. And so sometimes we have to switch to another formulation because of that, and not because the medication is not available in the hospital. And so, one of the solutions is to put an NG tube to give the medication, so it's not comfortable, but it helps you get the right medication that you were taking at home. And then there's sometimes conversion to some of the patches for medication that can also be given to some patients. And so this is kind of like one of the main issue with medication, and you potentially heard that before, and that's my tip number 4, is timing is everything. And you are the best advocate to tell your providers. So we can work all we want with providers locally, and it's really hard to reach all of them. But you as a patient and you as a caregiver can definitely be the advocate of, my husband, my wife, my brother needs to take their medication on time. It's crucial, because otherwise some complications may happen. Already mentioned this one. I will just mention it once again. Self-administer medication if it's possible. So if you are feeling good enough, or if your care partner is always with you, ask if you could take medication on your own schedule. Because unfortunately, the nurse, they have sometimes 4, 6, 8 patients to see. So at 4 p.m., when you need your dose, they might be busy doing something else. And we would love for them to be there at 4:01, the medication is in your mouth. Sometimes it's hard. So if the hospital will allow you to take medication on your timing the same way you do at home, that's ideal. But that's also taking for granted that you're able to do it, or that someone is with you and able to do it. Provide your own medication if you can. And if the surgeon wants for you to not take any medication for 12 hours or 3 hours or 4 hours before surgery, have that discussion with them. Can I just take my carbidopa levodopa with just a sip of water? And most of the time, they will say yes if they know that's the only thing you want to take. Okay, so don't hesitate to ask, and tell them it's super important for me. And once the procedure is done, you want to resume medication as quickly as possible. And so never hesitate to ask. Sometimes we're shy to ask our doctors. I'm shy to ask my doctors, even if I'm a doctor. So don't hesitate to ask. Can I just take my carbidopa levodopa? And I promise you, most of the time, they will say yes. That's another super, super important topic, is how some medication can make your Parkinson worse. Did you know about that in general? No? So I'm seeing people didn't know about that. So that's great. It means that I'm doing my job today. So you know how Parkinson's is an issue of you're not producing enough dopamine. And so there's a lot of drugs on the market that actually block dopamine because it's a desired effect. So the people that have schizophrenia, or people that have psychosis, and it could be psychosis in dementia, so we want to reduce their dopamine for different reasons to make sure that they're less delusional. And so a lot of those medication, the antipsychotics, the neuroleptics, these medication can actually worsen your Parkinson. And that is super important because getting those medication can make your motor symptoms worse, but also, again, the same thing, longer hospital stays, higher mortality rate. So we want to make sure, unless it's absolutely needed and you're super confused and you're hitting people, and hope it's not going to happen to anyone, but unless you get there, we want to make sure that those medications are avoided as much as possible. So these are, on the left, some of the safe medication for confusion, hallucinations, delusion in Parkinson. So we have pimavanserin, quetiapine, and clozapine. So these are the ones, if your doctors have talked about it, if you're on it, totally safe. It's not going to worsen your Parkinson's, even though there are antipsychotics and they are dopamine blockers medication. They just work on some receptors that make it safer. The one on the right are the ones we don't want you to get. So the number one that is probably the worst is called haloperidol. It's Haldol. And unfortunately, it's used a lot in the hospital if people get very confused because it's very effective. It can be given in the muscles. And so this is one of the drugs that we're trying to get the word out that people shouldn't give it to people with Parkinson's. And then the other ones that you might have heard about, risperidone, olanzapine, aripiprazole, they all can also worsen Parkinson. And there are also some medication for nausea that can worsen Parkinson, and you should be aware of that too, because some of these medications are to treat nausea, some are to treat headaches. And so metoclopramide, Reglan, or Maxaron is a medication that blocks dopamine too and can make the Parkinson worse. The one that are very safe, Zofran, ondansetron, is very safe, and it should be the anti-nausea drugs that people with Parkinson's take at home or in the hospital, okay? And so tip number 5 is, and you already did it, is to know what to avoid. And that list of medication is in that same website that I'm gonna put once again at the end on the Parkinson's Foundation website. And so you can print it, always have it with you, always able to give it to your doctors too. And so it's going back to those kind of stats I gave you. And it's not all dark, okay? I'm telling you, there's a lot of solutions out there, and those solutions work. One of them is doing what we do now, is getting the word out, doing education for people with Parkinson's, their care partners, but also for medical staff, for nurses, for anyone that encounters Parkinson's in their practice, which is basically pretty much everyone. And then we talk about some of the solution, making sure you can self-administer meds, you can bring your own meds from home, making sure that there's always adherence to your outpatient timing and doses, and we want to implement tools in our electronic medical records with alerts saying, like, this patient has Parkinson's, don't prescribe these drugs for them, right? So that seems pretty simple to do, but these systems are really, really complex. And so just having an alert saying, Haldol, haloperidol shouldn't be given to that patient, that is something that we want to do and implement because it can be very useful in getting the word out. And these solutions work. And basically what this data is showing you is just doing 30-minute education for staff, putting stickers saying, don't prescribe these medications for Parkinson's, and making sure that pharmacy reviews the medication list. Just these 3 things reduce medication error rates in one hospital from 22.5% to 9.3%. So it's not perfect, but it's much better. And the complication rate reduced too. And then it's hard to say, like, there was one death in that first group, it's a very small number of people, but basically it helps. Another example, and there are a few studies out there, shows that just these alerts in the electronic medical record, using education for nurse and physicians, and then doing a ground round lecture, so just these 3 things, change, so the people that were receiving their medication in that 15 to 30 minute window, it increased from 19% to 23%, which is, if you have a lot of people being hospitalized, it's a great improvement. And then the dose that were received after 30 minutes reduced from 46% to 39%. So we're still not there yet, but there are things out there that can be implemented and that work. We'll go over quickly the other things. Medication was definitely the bigger one, and this one is how when you're in the hospital, you don't move. And that happens to everyone, but it's even more crucial for people with Parkinson's, because if you don't take your medication on time for some reason, and then you're not moving, definitely the outcome in that spiral is your Parkinson's worsen, and because your Parkinson's worsen, you're moving less, and you're kind of in that spiral of just things are not getting better, and you might have a higher risk of motor fluctuations, wearing off, the freezing when you walk, and that can lead to falls, and even trouble swallowing can happen with moving less and not taking medication on time. So tip number 6 is to keep moving. And that's a hard one because hospital rooms are small and your care partner might not always be there, but there are a few things you can do. So ask for a referral for physical therapy if they don't offer you one. Try not to stay in bed. Sit at least on the chair, and not staying in bed all day is definitely helpful. Have that discussion with the people that are taking care of you that you want to prevent falls, because you know how important this is. And then if you have a walker or a cane, make sure to bring it to the hospital, because if you don't have your walker with you, sometimes they're not able to provide you one. So make sure you always have your walker with you, or ask someone to bring it in your room, so you're able to at least walk a little bit with it a few times per day. The other problem is that we encounter in the hospital is trouble swallowing. So some people have baseline trouble swallowing. Some people will have acute trouble swallowing while in the hospital. And we know that, so trouble swallowing in medical term is dysphagia. And we know it's a major risk factor for pneumonia. So if you have trouble swallowing and it goes in the wrong pipe, you can have some of the content in your mouth or the food that you eat that goes into your lung. And that can cause pneumonia, and specifically, you might have heard about that, aspiration pneumonia. And what's tricky about aspiration pneumonia is sometimes people don't even know that it goes into the wrong pipe. And so some people can have the silent aspiration, where the food content or the mouth content goes into the lung without them choking or coughing. And so it's super important so if you don't have regular swallow studies, to have that when you are a little bit later in the disease. And then when you get to the hospital, is making sure that you're concerned about it, people know about it, and they can do some screening. And you can also ask to see speech-language therapy to make sure your swallowing is fine. We know that pneumonia is a very common hospitalization complication and comorbidity, and it can happen to up to 6.3% of hospital stays in the United States. And so those data are a little bit outdated, but it's probably pretty similar. So it is very common. So tip number 7, which is my last tip of the day, is swallow with care. And make sure you get a screening when you get admitted. If there's anything that kind of change, or this hospitalization is worse than just like a regular routine, surgical routine hospitalization. If you already have trouble swallowing, speak up, or ask your advocate to speak up and inform the staff about your swallowing difficulties and that you might need to see someone about it. If you need alternative medication options, like some of your pills are hard to swallow, there's also place for discussion about that, working with a speech therapist. And then in general, when you eat, and some of the things is like, if you eat in your bed, kind of lying down, of course it's gonna make you a little bit more at risk of having food and drinks and things in your lungs. So making sure that you always keep a good posture, having your chin down when you drink, and keeping those strategies when you're in the hospital. And you might not be able to do that or to remember to do that, but your care partner will be there to help you. And that leads me to what here we're doing at UF with the Fixel Institute to work on those issues. And the main thing is right now, there's this big Safe Hospital initiative that combines people from the teams that are involved in that from everywhere in UF. So it's people from technology that works with the electronic medical records, people from nursing, rehab, us as neurologists, and pharmacy. And so we meet regularly and talk about different solutions and things that we can implement to make sure your hospital stay is safer. We work with the Parkinson's Foundation to elaborate recommendations for safer hospital stays. And right now, we elaborated the recommendations with the solutions, and we're working on implementing the solutions. And things like today, having educational activities and working with getting the word out is definitely part of that initiative too. So I'm going to conclude with the 7 tips so they stay in your mind. Next time you need to go to the hospital for you or for your significant other, be ready, okay? So tomorrow you're going to work on your go-to bag. It's going to be there at home, and everyone will know where it is. Speak up if you're hospitalized. Tell people that you have Parkinson's, and don't hesitate to tell them about the importance of taking medication on time and not stopping medication. Choose your advocate. Right? Find someone, it could be a neighbor, it could be a friend, it could be your significant other, that will be able to talk for you and to advocate with you during your care in the hospital. The 4th one, the most important one, I think, timing is everything. So making sure that the whole team knows that at 4 p.m., you need your carbidopa, levodopa. Okay, so, and find strategies to take your medication at that time if they're too busy to give it to you. Know what to avoid. Now you have an idea of the medication that can be avoided. You can go on the Parkinson's Foundation website, print the list, always have it with you. Always keep moving. It's important while you're out of the hospital. It's even more crucial while you're hospitalized. And then the last thing is always think about swallowing with care, making sure that when you're hospitalized, your swallowing didn't get worse and will minimize the risk of aspiration pneumonia. So that was it for today. This is the website I mentioned briefly before that you can take a picture of or write down. All the information you need is there. Print the list of things that you can bring with you. And it was really my pleasure to be with you today. I would do both, okay? So the question for people that might not have heard it is, should I take the bottle with me with the medication, or should I take the list, right, of medication? Yes, like a pill dispenser? Mm-hmm. Yeah, so it's very hospital dependent. So always have, I think both are fine. Like if you have the pill dispenser, or the bottle, but every hospital is different. So that's why you have to ask, okay? Hopefully, people will, hospitals will be more flexible with time and will understand the importance of, we have all of these new drugs. It's impossible that the hospital carry all of these new drugs. So hopefully, they will understand that, and we're working on it. But definitely always have, I would say you can even bring both and see what they will allow you to give. That's a very good point. And so that's why having a list with what you're actually taking that is written down, and the Parkinson's Foundation website has these kind of lists with just the lines and the dose and the timing. I would always have an updated version of this, because of course they will look at the bottle and they're going to be super confused. Are you week 1, week 2, week 3? Where are you? And then sometimes we all know that you'll send a message to your doctor and your doctor say, oh, take 1/2 more at this time, or take an extra in the middle of the night. And that might not be reflected in the prescription. So always have an updated, like write it down, what you're actually taking and not what is written on the bottle. Okay, I had this question first, then this and this. So putting it as an allergy or contraindication, yes, great idea. So that's one of the solutions I didn't put up there, but if you want to take that list that I showed up and put all of these as allergies, that would be amazing. Great tip. That have antibiotics that have interactions, you mean? I don't have one in mind. The antipsychotics, the neuroleptics, definitely. Most antibiotics are okay. Sometimes they will want some medication to be separated from your carbidopa, levodopa. I don't have a specific list for you, but usually it's so. But if you can give me the name of and what was the issue, we can. Yeah, in general, antibiotics shouldn't cause any problem with the carbidopa, levodopa, or the Parkinson's disease, okay? But then everyone has different issues. Sometimes might be a lot of problems with antibiotics could be the kidney-related issues. So some people that have kidney that are not functioning 100%, some antibiotics cannot be given. But in general, it's not an issue. I totally agree with you. I think any ways of having someone available and having a care partner available, or someone that is going to be your advocate, doesn't mean that the person needs to be next to you. I totally agree with you. And some people have family that is not living in the same city as them, so that makes it harder. And that's why, like, I think having a bag with already some information in it, that if something happens and that person is confused and there's no one else to be the advocate, at least the doctors have some information. But I agree with you.
Finding that the nurses and stuff don't know that much about Parkinson's.
No, and so the comment was, unfortunately, some of the nurses don't know about Parkinson's. And I would tell you, unfortunately, some of the doctors don't know much about Parkinson either if they're not trained in neurology. And so that's why providing some information might actually be useful, because if you're telling your situation and you're like, my medication on time is super important, it's gonna help also the next person, right? It's kind of you're providing education for them in some ways. And so it's really hard because they have so much to learn that they cannot like spend, just like me, 2 years just training about Parkinson's disease, right? I have the luxury of doing that, and it's easier for me now. But that's why we need for you to be advocates for that too.
Recently, I've converted all of my medical facilities over to Shands, and you have health, right? So other than getting a list of my meds in case I get knocked on the head in the knockdown game like a young man I knew did, and end up in the hospital at Shands without my wits about me, is there anything else I need to do, or Shands got it all figured out?
So if you're hospitalized at UF and you're getting your care here, it's great. And I'm going to be very short about it because they're going to have access. But let's say you leave Gainesville and you're hospitalized somewhere. I would say even if you don't have Parkinson's disease and it's Parkinsonism, all of this applies, 100%. So I would say bring the same information, the same papers from the Parkinson's Foundation. You can cross Parkinson's disease and just write Parkinsonism, because I guess people are still figuring out which box fits for you, and exactly the same recommendations. Okay, I think my time is up, but I'll be there for questions during lunchtime. So thank you very much.
And something really nice I'd like to share with you that Dr. Carpentier has been helping with is we're actually creating a training for nurses that every nurse in Shands Hospital will be required to watch about Parkinson's. So this is just extraordinary. We wish every hospital could do that. It's going to be the high yield points so that it won't be too much of a burden. Our nurses work very hard, and this is going to be a very quick down to the nitty-gritty PowerPoint that everyone will need to watch. So we're working on that. But sometimes people live in other towns and they won't come to this hospital, and that's where having a wallet card is really super helpful.